So what is bronchiectasis? Bronchiectasis is the abnormal dilatation of the airways, and according to the Reed's classification, he classified the bronchiectasis into three types on the basis of radiological CT patterns. So if this is the normal airways, so in that sense we can say that this is the abnormal dilatation of airway. So you can compare, and this is obviously the dilated airways. If they are present in a uniform caliber pattern, then this is the cylindrical bronchiectasis. If they are having the airways is having the beaded appearance like this, or outpouching of the airways like this, then this is the varicose. And if they are having the sac shaped or the cyst shaped airway or bronchus, in that case it is called as the cystic bronchiectasis. If we talk about that radiologically, so here in this CT we can easily find out that the bronchus are actually dilated. There is the abnormal dilatation of the airways or the bronchus, and they are having a uniform caliber, right? They are having a uniform caliber. They are in a straight line like this. You can see bilaterally this pattern, isn't it? If you talk about, so this is which kind? This is the cylindrical bronchiectasis, right? That's how we identify cylindrical bronchiectasis in the HRCT thorax. One more CT scan. Here what we can see is there is also the abnormal dilatation of the bronchus, but here we can see that there is some sort of beaded kind of appearance present over there. So that is beaded kind of appearance. If you are seeing in the bronchus on the HRCT thorax, then that is probably the varicose bronchiectasis. And if you talk about the cyst like appearance in the HRCT thorax, for example over here you can see a cyst like bronchiectasis, right? Cyst like abnormal dilatation of the airways, and sometimes the mucus can be filled over here. Mucus can be filled inside this cyst, and sometimes because half of the sac will be filled by the mucus, and half of it with the air, sometimes air fluid sign can also be appreciated in the cystic bronchiectasis overall. So this is the cystic bronchiectasis overall. Among the bronchiectasis patient, cylindrical bronchiectasis is the 45% of the bronchiectasis patients, varicose 10% approximately, and 45% in the cystic. But it differs according to the geographical areas, according to the country to country it varies as well. But overall, if we talk about the bronchiectasis, this is the abnormal dilatation of the airways, and usually on the basis of HRCT thorax patterns, radiologically we divide them into three parts according to the Reed classification, that is cylindrical, varicose, and cystic. And cystic is also called as the saccular bronchiectasis. Cystic is also called as the saccular bronchiectasis as well. Thank you.